nutrition is huge in helping even reverse diabetes and diabetic retinopathy, which is amazing. I mean, we were not taught, I was not taught in medical school that diabetes is reversible, but through lifestyle medicine and my board certification, I've learned that it's reversible, which is just amazing. So diabetic retinopathy is also reversible to a point. Once you get to severe or proliferative diabetic retinopathy, I'm not sure it's reversible, but that's pretty advanced. And if you're at mild or moderate, you can definitely reverse it. Regular BMI, normal waist circumference is associated with a lower risk of diabetes, as you all know. You know that diet sodas and high calories, rice, choline, those all increase your risk of diabetic retinopathy. High sodium intake increases your risk of diabetes progressing in your eyes. Just so interesting. Okay, let me move on. So all the things that you would do for your diabetes, you want to do for your diabetic retinopathy. Eat your whole foods, your fruits, your veggies, your fiber, your omegas, they all protect against diabetic retinopathy. If you're regulating the blood sugars in your body, you're regulating your eyes. A regular doctor wants to have an eye exam once a year because we can see those blood vessels and any damage. But one other kind of side note is if there's bleeding going on in your eyes, in your retina, if there's cholesterol depositing, guess what? That microvasculopathy that's happening in your eyes is happening in your heart, it's happening in your kidneys, it's happening in your liver. So it's actually a marker for everything that's happening in the rest of your body. So if you can reverse diabetic retinopathy and eye disease, you're reversing it throughout the rest of your body as well, which is pretty darn amazing. Our bodies can heal if we give them the right tools. So lutein, which is a big one in kale and helps for macular degeneration, also has protective effects against diabetic retinopathy. Vitamin C, another one that we've talked about for cataracts, also has protective effects against diabetic retinopathy, which is pretty amazing. No evidence on vitamin E or D, and then healthy lifestyle risk reduces your risk of diabetic retinopathy by 30% if you can meet all those criteria,